Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Periampullary tumors of the pancreas as well as covering their symptoms. So we are mainly seeing the symptoms from the higher order to the lower order, starting with jaundice. So jaundice amounts to about 75%, that is 3/4 of the total. Then comes weight loss. So weight loss is about frequency about 51%. Then abdominal pain is seen in about 39% of the cases. Next is the NV, that is nausea vomiting. This is in 13%. Then pruritus will be in 11%. Then comes presence of fever. Fever is seen in 3%, as well as there is a GIB, that is GI bleeding. Bleeding is seen in about 1%. Now, let's recap what we did. So we saw the periampullary tumors of the pancreas and their presenting symptoms. So most commonly it is a jaundice that is seen in 75%. There is also presence of the weight loss. Weight loss is seen in about 51%. There is presence of abdominal pain. It is seen in about 39%. There is nausea and vomiting. It is seen in 13%. Then comes the pruritus, which is in 11%. Fever is seen mildly, that is in about 3%. Then GI bleeding is very rare, that is in 1%. To learn and grow daily like this, please do subscribe.